After surgery, the incision or the surgical area can be very sensitive or even painful. The nerves are damaged in the area due to the surgery, and this is what causes that hypersensitivity and that pain. My name is Kelly. I am a physical therapist and I specialize in lymphedema and cancer. And today in this video, I'm going to share how to decrease pain and hypersensitivity after surgery such as a mastectomy or a liposuction or plastic surgery or even any other surgery. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram or check out our website for more resources. So we're going to talk about both pain and hypersensitivity, but first let's start with pain. Pain after surgery is normal and it can be caused by the damage to the nerves during the surgery, or it can be caused due to swelling and inflammation in the area from the surgery. Swelling to an area after surgery is completely normal. You are going to have more blood flow and more inflammation in the area for the healing process. However, this swelling, which can cause more pressure in the area, can be really achy or even throb. The swelling may be around for a couple days or a few weeks for some, and for others, the swelling may linger on for months. So once someone is cleared by their doctor or their surgeon for safety, they can try things like icing or gentle compression or manual lymphatic drainage to help decrease the swelling, which will then decrease someone's pain. It's important to know that swelling can ebb and flow for up to a year after certain surgeries, and so things may fluctuate on and off, especially as you become more active. Gentle compression to an area can be a really nice way to help decrease swelling, but also help avoid swelling from building up. So if someone had a mastectomy surgery or a breast surgery, some things they can try are things like compression bras. These specific compression bras are from Prairie Wear. They are meant for swelling and lymphedema. They have a special stretch and a fabric, and they don't have a lot of seams, which can tourniquet or put pressure in certain areas, which will make the swelling worse. And so these are some great options, which I will link down below. But you can also inside of these put things like swell spots, which are different foam shapes that can help put gentle compression even further on an area to help decrease swelling. So I will link both of those down below. If someone had more of a liposuction surgery or an abdominal surgery, you can try things like compression leggings, or there are things like fajas or compression garments for after liposuction surgery, and I will link some of the most popular brands that therapists love down below as well. If someone had surgery in their legs, or maybe they even had like a knee replacement, they will want to try something like compression stockings to help with managing swelling in the legs. The compression stockings are also really nice to help decrease someone's risk of getting blood clots. A lot of times the ones that you find at a drugstore or they give out are not a very strong compression, so they really don't work well for swelling. So if someone has those and they realize like these aren't working, most often it's because of the type they have. And so these are medical grade compression stockings that you can get online. They are 20 to 30 millimeters of mercury of pressure compression, which you may see some numbers, that's what that means. But they do a much better job of containing swelling after surgery, which can also help with pain in the area. Like I mentioned, I will link all of my favorite products that I just spoke about down in the description box down below. But now if someone has surgery and they have rapid swelling that comes on, a week or two later or even a few weeks later, and the pain is increasing and they notice more redness or fullness, that may be a sign of infection, and that can be very serious. And so if there's a dramatic change or the pain's getting worse or you are not sure, it's always best to reach out to your doctor immediately or get urgent support or urgent care at the emergency room or urgent care for an assessment to get this addressed, because we want to make sure that we don't have a spreading infection, and you also want to make sure that you don't have something like a blood clot. So the other form of pain that we're going to talk about today is that hypersensitivity. This is when the area that the incision's in or the area of surgery is very sensitive to touch, even to the point for some that their clothes can't touch their skin because it is so painful to touch. Hypersensitivity is kind of the opposite of numbness, where numbness, the nerves are damaged and they're not working enough or they're not working properly, whereas hypersensitivity, they're overactive and overstimulated. So it's more of a neuropathic pain, or it may fall under post-mastectomy pain syndrome for those who had breast surgery. It just depends. But yeah, if someone's very sensitive to touch after surgery, that is more that hypersensitivity. So how do we treat that? We treat that with what we call desensitization. Desensitization is when we do some sort of tactile touch that is usually light to help calm down the nerves. You have 7 trillion nerves in your body, which is an astronomical amount, and they're nerves that do different things or have different roles. So some nerves, their role is to sense light touch. Some nerves sense hot or heat, some sense cold, some sense sharp pain or sharp touch. They're all different, but in this case, these light touch nerves, or these nerves, are very, very overactive or overstimulated and very sensitive. And so what we do is take a well-cleaned hand or light fabric, like something like a soft Kleenex, cotton ball, Q-tip, something very gentle, and lightly touch that area that is sensitive. We want to make sure that it's tolerable. We have to start low, but even starting with 2 to 5 minutes at a time can help calm down and kind of re-stimulate and normalize those nerves. Now that can be done a few times throughout the day, and as someone starts to tolerate that more, we want to try different types of fabrics to get all the different kinds of nerves. So then we might go to something a little more rough, like a washcloth or maybe even denim, but we want to avoid anything that's going to scratch, cut, or damage the skin even worse, because that can make the nerves more hypersensitive. For some individuals, warmth can also calm down that hypersensitive nerve. When nerves tend to be more cold or the body's more cold, nerves are a little bit more sensitive overall. And so putting warmth on the area for 10-15 minutes can calm down some of those nerves. It's just really important to make sure that we know the exact temperature of whatever you're using so that we're not causing any damage or burning the area. Lastly, some people will need to work with their doctor to be prescribed some sort of topical cream like a lidocaine or numbing cream or another medication to help calm down nerves that are overstimulated. That is something that you'll want to reach out to your doctor if you think that might be something for you, but that can help calm down nerves as you continue to work on that re-stimulation and rewiring of the nerves. Just know that nerves take a long time to heal. They don't necessarily heal as fast as other tissues or muscles in the body. They can take weeks, months, or even years for some individuals. It is something that you want to continue to work with, because the worst thing someone can do is not do anything and avoid that area that is hypersensitive, because that is not going to allow for any sort of progression or improvement in the nerves. So work with a therapist or some sort of certified lymphedema therapist in your area to find a desensitization program. As a reminder, this is not personalized guidance, so be sure to work with a doctor in your area. This is more general information only. But I hope you found this video and this information helpful, and we'll see you all in the next video. Thanks, everyone.